Hi there. Good afternoon. What brings you into the clinic?
Hi. So I'm a little embarrassed. I've been having some issues with leaking urine, and I saw this ad on TV, and it said that there was a product available that you don't need a prescription for that could help with people like me. So I just wanted to get some more information, see if that's something you can tell me some information about. It's just, I don't know. It's really embarrassing.
Okay. Well, sorry to hear you're having that issue, and we can definitely talk about coming up with some solutions for your problems. And but I'll need to ask you a bunch of questions from you if that's okay.
Okay.
Okay. So let's see. We'll need to get a little bit more detail about what's going on. How long has this problem been happening? When did it start?
It's been going on for about 2 months now. Yeah, it
Okay.
started about 2 months ago.
Okay. And then so in a typical day, how many episodes does this happen in a typical day?
Oh my God. I think it happens every few hours. It feels like it's just
Okay.
many, many times a day that I'm having problems.
Okay. So it sounds like it's really bothering you then, huh?
Yeah, I mean,
Oh,
I can't even
yeah.
get to the bathroom in time before I wet
Okay.
myself. It's just, yeah,
Okay.
it's
So,
affecting, I have to stay near the bathroom. It's
okay.
affecting what I'm doing on a regular basis. So,
Okay.
yeah, I'm
So,
hoping you can help.
sure. Yeah, so I got a couple more questions for you. Now, when you do lose the control, is it just usually just a little bit, like a little spot, or is it you have a real big urge where you really have to go?
It's a lot. It's a lot.
Okay.
I lose
So,
a lot. Yeah.
okay. So you lose a lot. Now, is there anything that you've been doing that helps you, that has helped this problem for you?
No, I mean, I wouldn't say that anything has helped. I've been trying, those diapers, those adult
Mm-hmm.
diapers. I
Yep.
tried those, but those leak too because it's so much urine. It just
There's a
leaks
lot of
out.
volume.
Yeah, yeah.
Okay. Is there anything that makes it worse, like coughing or sneezing?
No.
No? Okay. And that's so. All right. So it sounds like we've got a pretty good idea of what the problem is now. What are the medical problems that you're being treated for? Do you have any diagnoses or conditions you're also being treated for?
Just hypertension and asthma, which I go to your clinic for.
Okay, so we've
Yeah.
got record of you here. Okay.
Okay.
Now, do you smoke or drink alcohol or use any
Oh,
recreational drugs?
no, I'm too old for that. No.
Okay. All right. Do you drink any caffeine, like say tea or coffee? And if so, how much?
Oh yes, absolutely. I have to have my 2 cups of coffee a day, but
Okay.
that's all. That's all I have is just the 2 cups a day.
Okay. 2 cups
Yeah,
of coffee.
yeah.
What's your living situation? Do you live alone or do you live with family?
I live with my husband. We have 2 children, but they moved out a long time ago. They're both
Okay.
working and doing well for themselves. Yeah, so it's
That's
just my
that's
husband and I.
Okay, that's wonderful. That's really good to hear. Now, I need to know a little bit about your family medical history. Were there any diseases or things that your immediate family members, such as your mother, father, brothers, or sisters, had? Any medical
Well, I
conditions
don't
that
have
they
any
had?
brothers and sisters, so it was just the three of us. And
Okay,
my mother passed away from breast cancer when she was 67, and
okay,
my father passed away from a stroke when he was 60. So yeah,
okay,
it's just me now.
okay.
Yeah,
Well, sorry to hear about that,
thank
but
you.
we always like to check out and see what family histories are to make sure that you're not at risk for other conditions. So now I have several other questions I want to ask you now. Do you have you had any trouble with increased amount of thirst?
Not
Have you
that
felt
I've
really
noticed.
thirsty lately?
No, not that I've
Okay.
noticed.
Do you have any pain when you urinate?
No, no,
Okay. Do you have any eye conditions or eye problems?
no. Just these glasses, yeah, that I've had for
Okay.
about 20 years now.
Okay. How about
Yeah.
any heart conditions?
Just the high blood pressure that I mentioned.
Okay. And how about any problems with your thyroid?
No.
Okay. And then any problems with with constipation or diarrhea or any stomach problems?
No, no, I'm very regular, which I'm very happy
Okay.
about because some of my
That's,
friends they tell me they have
yeah,
problems, so
that's a
I've
good
been
thing.
good. Yeah.
Okay. Fantastic. So moving on, do you have any allergies to medications?
I just have, so a long time ago, I took some pain medicines right after
Okay.
I had some dental surgery, and I got
Okay.
so constipated I couldn't go to the bathroom for a week. And that's when
Okay.
we added that as an allergy because I have an allergy to these pain medicine.
Okay. Do you remember what it was called?
Oh, it was a narcotic. That's all I remember about it.
Okay. So it
Yeah,
gave you constipation. Okay. Any
yeah,
other
yeah.
allergies that we need to know about?
Just these sulfa that my doctor said to mention that every time is sulfa drugs.
Okay. Okay. And what happens when you take a sulfa drug?
Oh my gosh, it was so long ago, but I think I broke out
Mm-hmm.
into a rash. I think that's what I
Rash,
remember.
huh?
Yes.
Okay. All right. So now, what are the medications that you're currently taking? Do you have a list or do you have your bottles with you?
Oh, I have my list with me. I carry that with me everywhere. And
Okay,
that was
good.
after you told me to do that a few years
Okay,
ago.
good,
Uh,
good, good. And now,
so
where do you get your medications filled?
at your pharmacy, I don't go anywhere else.
Okay, good. All right. So you
Yeah.
just come here. So which ones are you taking right now?
So I just take the lisinopril. That's I think the
Mm-hmm.
peach one. I think that's the 20 milligram one.
Okay.
And
Okay.
then
And what do you take that one for?
I think that's for my blood pressure.
That is correct. Yes. And how long have
Yeah.
you been taking it?
Oh, going on 10 years, I think.
10 years. Okay.
Yeah.
All right then. And then what else are you taking?
Oh, water pill. It's called HCZT.
HCTZ, hydrochlorothiazide, right?
Yes.
Okay. And how many milligrams do you know?
25 milligrams of that.
Okay. And then how often?
I just take that during once a day, just like my lisinopril.
Okay. And what time of day do you take that?
I take both of them right at breakfast, so at 9 a.m.
Okay. So
It's
the
the only way I
lisinopril and
can
the,
remember, it's the only way I can
okay.
remember.
Okay. Is there anything else that you're taking?
And then I take something for my breathing. It's
Hmm.
Singular. I take that
Singular. Okay.
once a day in the
Okay.
evening.
Yeah.
And then I have my inhaler, but I don't really
Uh,
use that on a daily basis.
okay. Do you know the name of the inhaler or what it looks like or what color it is?
It's the albuterol. It's gray and blue, I think.
Like a blue gray color? Okay.
Yes, yes.
All right then. And then how often do you have to use that in an average week?
In the past I had to take it every time I went gardening, but I haven't been going gardening lately because of
Hmm.
everything that's happened. So I haven't had to use it for more than
Okay.
once a week these days.
Okay. And
So
then how
that's a
long?
blessing in disguise, huh?
Yes, yes, it is. How long have you been using your albuterol inhaler?
Oh, many years, many, many years.
Okay. And then how about the Singular? How long have you taken that for?
Going on seven, I think, 7 years, I think.
Okay. All right. So for a while
Yeah,
then. Okay.
yeah.
So now moving on, do you take any over-the-counter medications or non-prescription medications?
Only thing I take over the counter is what I buy here, which is the
Mhm.
Tylenol PM,
Okay.
and then just a multivitamin and some calcium, with
Okay.
some vitamin D, I think.
Okay. So you take a multivitamin and then also a separate calcium tablet, right?
Calcium and vitamin D, they said it's good for my bones.
Okay. All right. That's a good one. Do you happen to remember which one that you take?
I think it's the calcium citrate.
The citrate, okay,
Yes,
and that is the Citracal that you take the one that we sell here?
I don't know. I think so.
You got it here though, correct?
Yes, yes.
Okay, very good. And then how many and how often do you take those?
Oh, I take 2 tablets twice a day.
Okay, and then
Yes.
you take them with or without food?
Without?
Okay, you can take them with or without food. It doesn't matter.
Okay.
So that's good. Just checking on that. And then how about any herbal medications? Do you take any herbal medications?
No, I only just take this pill, the cranberry pills. I've heard those are really good to stop from getting UTIs. That's the
Oh,
only
okay.
thing I take.
Okay, so you take a cranberry pill for urinary
Yes.
tract infections.
Yes.
Okay, all right then. And then do you take any traditional medications or home remedies or of
No,
anything?
I haven't. No.
Okay, all right then. So they're very good. So now when you take your medications, you say in a typical week, how often do you miss a pill?
Not very often. I'm very good about remembering. My
Okay.
husband will remind me to take my morning meds and my
Hmm.
evening meds with dinner. So
Okay.
I don't forget very often.
Okay, that's good. So that leads me to my next question. I was going to ask you if you have anyone that helps you with your medicine. So it sounds like your husband helps you out with the meds then, right?
He reminds me, yes, yes.
Okay.
He's very good. He's a very
Okay.
helpful man.
Okay, that's good to have. So now I got a couple more questions in that. Now, do you get any medications from outside of the country, like say from Canada or Mexico or India?
No, no, just your pharmacy.
Everything comes from here then.
Yeah.
Okay, very good. And then do you get any other medications when you go to a doctor's appointment, say like you get a shot or infusion, say once a month or once a year, or is there anything that any medications you receive at the doctor's office?
No, no.
Okay, all right. So that sounds like I've gotten all the information I need. So let me take a quick look at your patient chart, add this information into it, and then also check to see what if there is if that over-the-counter med you're asking about. Let's see if that's going to be helpful for you. So let me look into that, and I'll be right back. Thank you.
Thank you so much. I really
You're
appreciate
welcome.
your help. Thank you. All right, so now that the pharmacist has interviewed the patient, has gotten the information that they need to make their decision, the next thing that this pharmacist is going to have access to is the patient's electronic health record. Now, not every pharmacy has access to an electronic health record. In this case, this particular pharmacy is linked to a clinic system. So the pharmacist has access to the patient's data and has access to more information that maybe another community pharmacist may not have access to. So this patient is available in EHR Go. This patient is called Pramila Set, and the pharmacist will go into the patient's EHR, and this then opens up the patient's electronic health record. Now, in this case, this is just a simulation just to show you how this patient will get all the information, how this pharmacist will get the information that they need. So you can see here, you have your patient, you have where the patient is, which is in the pharmacy, you have your patient's date of birth, other information, you have the sulfa opioid, so the patient did provide that information, and it's also within your electronic health record, so everything is up to date like it needs to be. If you want to click into each of these and make sure that we have the documented allergy, which in this case is rash, that's perfect. Then you can go into the patient's problem list and you can see we have all the information that the patient mentioned, which is asthma, the hypertension, and she is status post-menopause, which we've documented there as well. Now, if you want to get a little bit more information about this patient, you can see the last time that we documented any kind of vitals was about 3 months ago. So you have your heart rate, you have respiratory rate, you have the patient's blood pressure from 3 months ago. The other thing that you're going to have is the patient's meds. And you can see we haven't documented any of the patient's home medications. So that might be something we're going to have to update when we go into this record and actually put in the medications that the patient has mentioned that she takes. But if you look here, the information we do have is her vaccine information. So you can see that she is current on her influenza. She got her Tdap a few months ago. She has had her Pneumovax a few years ago, and then she's had 2 doses of Shingrix. So you can kind of see if anything is incomplete that requires you to give her another vaccine. The other thing that you can see in the patient's chart is any notes that somebody else has written. So in this case, this Dr. Alberici has written a note, and this is from, again, the 30th of December, so it's been a few months ago. It was during the patient's annual physical exam, and the physician has documented information about the patient's annual physical exam. So this kind of gives us a little bit more information. The other thing that you can see here is that it says that labs were ordered. So as a pharmacist, you can go into the patient's labs. These are from 3 months ago, but that's pretty current. So if you go into the labs, you can see what her BUN, CO2, creatinine, glucose. So that tells you, okay, I better start looking at that. It was marginally high, but just still something to keep an eye on. The next thing is the patient's hemoglobin and hematocrit, which were both fine. So this is how you can get some supplemental information from the patient's EHR. So you did your interview with the patient, you asked them what's going on, and then the other thing that you're going to do is to look in the EHR and see if there's any supplemental data that you need to collect before you make an assessment regarding this patient.